Hello everyone, I am Arobinda Sarker, course BSc in Prosthetics and Orthotics, Bangladesh Health Profession Institute. Today I am going to talk about force or pressure distribution in prosthetic socket. In fitting of prosthesis, we usually aim to distribute pressure evenly over the residual limb. But before going to this topic, we need to be clear about some basic concepts. So let's start. So force changes a body from state of rest to one of motion, or changes its rate of motion. The weight of an amputee applies a force to the prosthesis. In these two images, we can see the patient is applying force to the prosthetic socket, and prosthetic socket is also giving a reaction force to the residual limb of the patient. Now pressure. Pressure is how much force is applied to a certain area. The formula of pressure is force divided by area. Pressure in amputation is equal to socket interface force divided by stump contact area. We will understand the force distribution in prosthetic socket by understanding this cube and bar concept in this picture. We can see there is a solid plastic bar, a steel cube and two elastic or rubber cubes. Now we will place the steel cube in the middle and elastic cubes in the two sides of the bar. Now when any external force is applied on the bar, the steel cube will handle most of the pressure because it is rigid kind of material and does not change its shape easily. Because of this, the force is not going to distribute evenly. To solve this, we can do some adjustment. We made a cut or relief in the bar. Now we will place the cubes in the same position. In this case, when external forces are applied, the cut in the bar allow to bend it. When the bar is bending, because of it, the elastic cubes will also bear some forces and they will change their shape and absorb pressure. It will help to distribute the pressure more evenly than the first case. In third case, we added some extra material on rubber cubes. These cubes are less elastic than rubber. When the external forces are applied, they can absorb more pressure than steel cubes because they can change their shape and distribute the pressure. This adding and build up on the rubber cubes helps to distribute the pressure more evenly than the second case. From this cube and bar concept, we have learned that making cut for hard material and adding or build up on soft material help to distribute the pressure. Now let's use this bar and cube concept in the transverse section of a socket. We can see the outer surface of the socket and the inner surface of the socket. The inner surface will make contact with the residual limb. Here we will consider our bone as hard and rigid material and our muscles and tendons as elastic and energy absorbing material. In the area of small circle, we can see there is uniform firmness. It means the whole area is made of same kind of material, either soft or hard. So we don't need to make any adjustments. The pressure will distribute equally here. But in this case, we can see there is firm area and soft areas. So the pressure will not distribute here equally. That's why we have to make some adjustments. And now we will use our knowledge that we learned from bar and cube concept. We will make cut or relief in the firm or bony areas and build up or add material in soft or muscular areas. These adjustments help to distribute pressure equally in the socket. In the firm area, we will try to give less pressure because it can deform permanently or breaks and called sensitive areas. And we will try to give more pressure in soft areas because they can absorb more pressure than hard areas without fracture and called tolerant areas. All these adjustments are done for equal force distribution in prosthetic socket. For further discussion, we will consider transtibial amputation. What is transtibial amputation? It is a surgical procedure where the lower part of the leg is removed below the knee. And what is transtibial prosthesis? It is an artificial leg used to replace the part of the leg that was amputated below the knee. We already know about pressure sensitive and pressure tolerant areas. Mostly the bony prominences are pressure sensitive and the muscular areas are pressure tolerant. So the pressure sensitive or tolerant area we will see next. Pressure sensitive areas. In transtibial amputation, the pressure sensitive areas are patella, lateral tibial condyle, tibial tuberosity, tibial crest, anterior distal end of tibia, fibular head, distal end of fibula, distal end of stump with surgical suture, medial femoral condyle and lateral femoral condyle. We will try to give less pressure in these areas. And the pressure tolerant areas are supracondylar areas, suprapatellar areas, patellar tendon, medial flare of tibia, lateral flare of tibia, lateral flare of fibula, posterior area of the stump, popliteal area, distal end of stump for total contact socket. So we can give much pressure in these areas. Now we will see the PTB socket or patellar tendon bearing socket interface. In picture A, we can see lateral supracondyle, medial supracondyle, fibular head, lateral tibia, medial tibia and distal tibia. We know these are pressure sensitive area, so we can't give that much pressure here. That's why we make cut or relief here from inside the socket. And we can also see the patellar tendon. We know it is pressure tolerant area, so we have added extra material here. In picture B, we can see popliteal depression, medial head of gastrocnemius and lateral head of gastrocnemius. These are the pressure tolerant areas, so we also added extra material here. In the picture of our right side, we can see the inside of the socket and the cut and relief areas and adding and build up areas. Here we can see a patient is wearing a PTBSC socket, means patellar tendon bearing supracondylar socket. So that's all for today. If you have any question, you can write in comment section below. Thanks for watching the video.